Hi, I'm Dr. Ken Gardner, and I'm a primary care physician with U of L Health in Eminence, Kentucky. I think when I was in school early on, I loved science and was good at science. And in those days, often your teachers would encourage you to think big. And I had several teachers that encouraged me to think about what that might lead to. And particularly when I was in the 7th grade, I wrote a term paper on diseases of the heart and veins. And my teacher just really encouraged me and said, this is the beginning of a journey. And it just meant a lot. It just shows what the words to a kid at the right time can have a lot of influence. I was an emergency medicine physician, including residency, and after it, probably 13 years. And I made the transition to primary care for a variety of reasons. I love the emergency medicine environment and the treatment. The hours and the lifestyle are not as family friendly. And I did enjoy my patients, the ones I got to know better. So it was an easy transition thinking about being more in longer term care and relationships with patients. We do minor procedures in the office, joint injections, suturing if somebody in one of the local plants is injured, also removing small lumps and skin cancers. I like to think, what would I want for me or somebody in my family? So I think that's helpful to think, how would I want to be treated. I think that's a little facilitated by the fact that I'm a cancer survivor, as is my wife, and that gives you the being on the patient side a little more. So I know if patients are waiting for significant tests, I know how anxiety provoking that can be, waiting for test results. So I try to be pretty diligent about getting results back to patients if it's something important, and understanding their anxiety and treating the whole patient, not just the growth that needs a CT scan, but also what are their emotional concerns about this and how can we treat that as well. Our practice is in Eminence, which is in Henry County, about 12 to 15 miles away, and there's of course no hospital there and no urgent care there. So, and some of our patients are seeing us have already driven a half an hour to 45 minutes from some of the surrounding counties. Maybe it's Trimble, Owen, or Carroll County. So it's great for things that can be treated here to keep our patients closer. I cycle. I don't do long distance anymore, but I try and when the weather is conducive, bike outside 3 to 4 days a week, anywhere from 10 to 15 miles. So in terms of fitness-wise, I do that. Music has always been a big part of my life, so I play keyboard poorly, but I enjoy it. And at times I've been in our worship band at our church and have enjoyed songwriting in that area, and with spending time with my family. I'm blessed that I have a great relationship with 2 adult daughters. If we can convince a second one to move back here from Colorado, then it'll even be better.